Dr. Heather Moore, owner of Total Performance Physical Therapy. Here we are in our North Wales location. This is video number 3 in our series of our online video back courses. We're going to go over some things you can do at home in order to treat your low back pain. You're here because you have found us either online or you checked out the first 2 videos in our course, and thank you for doing so. And also, good job on coming this far and staying interested and really trying to figure out what you need to do to possibly resolve your low back pain. So in the first video, we kind of went through some of the anatomy, some of the possible causes of your back pain. In video 2, we went through how you can differentiate, how you can diagnose some of these things at home, what you can look for in order to see, is it a disc, is it a nerve, is it a muscle, is it, or is it a combination of all 3? And now in this video, we're going to go over, excuse me, some things that you can do at home in order to alleviate some of this low back pain that you're experiencing. We get a lot of questions, is hot pack or cold pack better? Do what you feel, if you slip and fall on the ice and, you fall down a set of stairs, get ice on it right away, all right? Keep ice on it. Keep icing it every day for about a week. If you're dealing with a chronic low back pain issue, meaning it's been bothering you for months, years, weeks, whatever, and a good hot shower in the morning helps it, do that, A quick and easy way to create a hot pack: buy a tube sock, put rice in the tube sock, tie the tube sock off, throw it in the microwave. You've got a hot pack. You don't have to buy anything expensive. It's rice in a bag, and it works really, really well. So if you prefer heat, which a lot of people do the heat. If you like ice better, do the ice. You are not going to mess anything up. If you pick wrong, everyone's so afraid of picking wrong. Like I said, in that traumatic injury stage, in that traumatic fall stage, when you have a car accident, you want to get ice on it for the first week. 15 minutes, once a day, twice a day, whatever. But beyond that, choose which one you want. If ice is going to make you tense up, you're really kind of doing the reverse action of what you need. So just choose what you like. We recommend doing that if that's what you feel will help you. It's not a solution, it's not a fix, but sometimes at the end of the day, you're just like, I need to put a little heat on the back. What I don't recommend doing is getting a heating pad that plugs into the wall. A lot of times people fall asleep and wind up getting burns with those. So you just want to be careful of those types of things. So for this, what you want to do is we're going to go through 3 things that you can do for your low back treatment. And again, if you're doing any of these, if it gets significantly worse, you want to stop, okay? You definitely want to call your medical provider. These are really gentle exercises. There's nothing strenuous about these. So if it's bothering you too much or you're getting a lot of increased pain, you do want to stop and consult somebody before continuing on. Like I said, these are pretty easy to do, so you can do them once, twice, 3 times a day. Don't think that you just have to wait or you need a day in between. That's not the case at all. So one of the things that you're going to see is, so we're going to go through the lacrosse and the beastie ball. And what we're going to do is I'm going to show this to you. This is our beastie ball. You can use a baseball, a lacrosse ball, anything else. This, for me, is the most effective thing that we use in our clinic because it's got spikes on it. It really gets into the tissue. So this is our preferred method, but I know people at home have used all sorts of different things. One of the things you're going to notice is that we're going to do some work on the hips. And what you have to realize is all of this is connected. So while you may be thinking, it's not really my butt or my hips that are bothering me, yes, it is, okay? They're all connected. These muscles that are in your butt and your hip are all connecting your low back. So, it's not a matter of we can just treat your back. I wish we were able just to treat one area and just ignore all the others. But unfortunately, everything works in conjunction, so that makes it a little bit difficult. So what you want to do with this is, first of all, you can start by taking this at your desk, or like if car rides bother you, and this is another reason I love this, is this goes right in the purse. This goes right in the car with little to no effort. Apparently dogs really like to chew this, so that's finally heads up on that one. But this goes right, this is very portable. This goes on vacation with you. And what you can do is you can just sit on it, all right? And just roll around nice and easy, okay? Now, I don't recommend starting on your low back right away. You can work your way up to laying on this on the ground and putting it on your low back. Don't put it on your spine, but just put it on the sides of your low back and working those points out. But I would start just right here, rolling around on your butt, nothing, don't leave it there for an hour, but just kind of keep it moving. If you find a tender spot, stay there for about 20 to 30 seconds and then go on and move forward, okay? And then what you're gonna do is kind of our next thing is the piriformis stretch, all right? So with this, you're gonna cross your ankle over your knee, okay? You're gonna lean forward. You're gonna sit up straight and then you're gonna lean forward. You should feel a stretch all the way up into your back, into your glute. You may just feel a stretch in your hamstring. Don't push it. Stop when you feel the stretch. Some of you may be up here. This is a real indication of a problem. And we're gonna go through more of that in more of our hip course. But this and lean forward, okay? You can do this sitting at your desk. You can do this driving in a car. You can do this anytime throughout the day. This is going to open up that hip area, open up that back area, allow you to get into some good posture, all right? And just give you that ability to, open up everything. You can, as you get better, put this underneath your glutes and then sit here like this and roll around with it. That's perfectly acceptable. One of the things that I want to point out right now is about stretching. A lot of times I hear that people went to other physical therapists or whatever, or they had their trainer stretch them out. They should be good. The piriformis stretch is probably the only stretch I have anybody do. It's the only stretch I recommend doing. If someone is just stretching you out, they're not doing anything for you. Stretching has very little to do with injury. It has very little to do with what's going on with you. Down the road, is it a good supplement if you're working out? Sure, you want to stretch. But if it's injury that we're dealing with, is stretching a good thing? No. Is someone stretching you out? Is that manual therapy? No. If what you're doing is somebody's just stretching your hamstring out, be very wary of that. You don't want them to do that. If after a training session you have low back pain and your trainer's, taking your hamstring and jamming it back, you're causing yourself some more issues. So just be aware of that. This is really the only stretch that I recommend in doing, especially when you're injured. Now, we're going to do some low back extension, and I just wrote it like this. It's not really necessarily extension, but what it is, it's going to be finding good posture, okay? One of the biggest problems people have is being able to find good posture. So most of the time, people present in the clinic like this, all right? And if you look in the mirror, you're going to see a really big curve in your low back. Now, it really actually hurts me to stand like this, but this is how a lot of people come in, all right? So if you were to tuck your pelvis under, all right, and then go back and forward and back. Now, this is more difficult than it looks because a lot of people will do this to move their pelvis. A lot of people will do this to move their pelvis. This stays still. This stays still. All right? All you're doing is rocking your pelvis back and forth. Nice and easy. And you want to watch yourself in the mirror. Watch your knees. Watch your back. Okay? It should just be your pelvis. Back and forth. Nice and easy. If you have problems doing the standing up, start lying down, okay? And start almost by doing a crunch where you sit up, okay? And then eventually lose part of the crunch and just do your tilt. Forward and back, nice and easy. Now what you want to do is you want to find the halfway point between all the way back and all the way forward. Where is that? Right in the middle. That's where you want to stand, okay? Standing with good posture is 90% of the battle, especially if you stand for your job, okay? And if you wear high heels, guess what? You've got to recenter that when you're up on high heels, okay? So finding this point where you are halfway in between all the way back and all the way front, and you're right there, is half of the battle of understanding low back pain. So once you find this, you want your knees to be slightly unlocked. You don't want to stand with your knees locked out. You want them slightly unlocked. Roll your shoulders up back, drop them down. And this is good posture. All right? So when you do that, this kind of, you want to find this in sitting, you want to find this in standing. So at your desk at work, when you're sitting down, doing this in sitting is hard, but you want to go all the way to the end, in the back, and all the way forward, and then find in the middle. Nice and easy, okay, and that's where you want to sit. That's going to allow all of the pressure on your spine to go right through, down through your sit bones where it's supposed to. If you wind up sitting like this, and your back is arched, what happens is, where you're arched at and where that kink is at, that absorbs all the pressure. So if you're sitting there even for an hour, you literally have herniated your disc for an hour, okay? You're pushing that disc out the back. Whichever disc gets stopped at, you're pushing it out the back for an hour, okay? And then, you know, it's scary enough doing that, but then if you were to twist, I mean, you're really just asking for it. So finding a proper posture, doing this kind of exercise, and it's not going to be overnight. It's not going to be what I just did, where it's like, okay, halfway there, halfway, you know, go there, and then find halfway in the middle, be done with it. It's really not that easy, okay? It does take a while, even though it looks simple, and you're like, oh, how did I got it? It takes a while because you've trained yourself to be positioned in a different position for so long. So be very cautious of, you know, thinking that, okay, I did this, and now I'm done. It's going to take a lot. If you're not mentally thinking about it, if you're not consciously thinking about it, you're probably not doing it because it's going to take that much for you to be able to change that posture habit. So those are kind of the three big things that you can do at home, starting right now, to help you and help alleviate some of that back pain that you're experiencing. Because you've sat through all three of these videos and listened to me babble on, we're going to go ahead and offer you a free in-person consultation. So if you would like to schedule a 20-minute one-on-one consultation with a therapist, we'll look at you, take a look at your back, kind of see what's going on. Call our office at 215-997-9898, or you can just click to the link found in the email, enter your name and email, and we will get you in touch with you in order to schedule a consultation. Thank you so much for sticking with us through these three videos, and we will talk to you soon.